News Channel.
Welcome back. In the wake of the Supreme Court's decision to uphold the president's health care law, there's one group we haven't heard from: America's doctors.
Many fear the new taxes and regulations could put their practices out of business. Here with the physician's perspective, Dr. Ben Carson. He's the director of pediatric neurosurgery at Johns Hopkins. He was also awarded the Presidential Medal of Freedom. Great to see you, doctor.
Thank you. Nice to be here.
Why will this put doctors out of business?
Well, you know, do we need health care reform? Absolutely. There's no question about that. But the aim really should be to lower the cost and to make access better. What has happened with the increasing number of regulations that keep coming down, it seems like on a monthly basis, is it detracts from the physician's ability to take care of their patients. And it makes them have to hire more people. You have to hire all kinds of insurance specialists because there's so many different insurance forms and different ways of submitting bills, different ways of collecting. We need to bring some kind of uniformity there. We need to bring logic into the system, basically. And the more illogical we become and the more bureaucrat-based we become, the less effective the actual practicing physician becomes, and the more time he has to spend dealing with things that have really very little to do with medicine and patient care.
So, Dr. Carson, what does this mean for the patient, for the folks out there that are watching this show this morning?
Well, it means that there's going to be fewer physicians who can devote the necessary time to patient care because they're devoting time to so many other superfluous things. Couple that also with the fact that, you know, with this massive health care reform bill, there's nothing in it about tort reform. You know, this is a major problem. I know some have come along and say, well, it's only about $5 billion. That's a ridiculous number. It's much more than that, defensive medicine costs and the ramifications thereof. And one of the things I think that's going to be necessary, we can't simply sit around and complain about this 2,700-page bill. What we need to do is start talking about how do we replace it with reasonable, logical things that actually will get the cost down and that will make health care available to the largest number of people. We spend twice as much per capita in this country as the next closest nation, and yet we have these horrendous access problems. We don't need to pour more money into the system. We need to create efficiency.
Doctor, you sound like you're echoing some similar sentiment that we just heard from Ken Cuccinelli, the Attorney General from Virginia. He said that we need first to be able to compete for insurance across state lines. How would that change the equation? Because one of the concerns with this bill is that premiums, instead of going up, or instead of going down, are going to go up anywhere from 20 to 40%.
Well, yes, of course, we need to understand that we live in America and that the system that we have is a capitalistic free enterprise system. So let's let that system work. You know, it doesn't work when you bring into a system like that a bunch of bureaucracy. You're trying to mix and match things that don't work together, and you get the least efficient effects from both of them. So let's decide who we are. This is a big problem that we're having in this nation right now. Are we a free enterprise capitalistic society, or are we a government-run society? This is really the issue that this whole thing is coming down to. And we need to make it crystal clear to people what the effects will be of choosing one over the other. There's a lot of subterfuge that's going on here. This whole health care bill, a lot of subterfuge there, a massive expansion of government within our lives. And this is one of the things that the founders of our country actually feared, that we would get to a point where the people would lose their effect and the government would become massive and become an integral part of all of our lives, and we would no longer be a country for, of, and by the people.
Dr. Carson, we're going to leave it there. Thank you so much. We respect you immensely, your profession, and all the folks that are in your profession have gone to medical school. Thanks so much.
Thank you.
Coming up, a story